At the age of 5, Dr. Lynn Webster told his grandmother, who was suffering from multiple sclerosis, "When I grow up, I'm going to be a doctor, Grandma, and make you better. You won't hurt anymore. You won't have to cry." Years later, he implanted his first device to treat pain into a woman suffering from multiple sclerosis. Webster co-founded LifeSource in 2006 to educate physicians, patients, and communities on pain-related issues that affect health, as well as to fund and conduct research on new solutions. The first project developed was the Zero Unintentional Deaths campaign, which kicked off with a statewide tour of Utah. Since 2006, Webster has given nearly 70 presentations nationwide and written 50 published articles to help physicians identify patients at risk for pain medication misuse. He is board certified in anesthesiology and pain medicine and is certified in addiction medicine. Says Webster, the real heroes are patients and their families and friends who support them.
We don't understand the reasons why so many people have been dying.
As we reported in March, accidental death from prescription overdose used to be a small problem. About 6 years ago, it skyrocketed into a leading cause of death. It's now killing at least 250 Utahns a year, and the numbers keep going up.
That's an unacceptable level of harm.
As president of the Utah Academy of Pain Medicine, Webster is launching an educational campaign for doctors and patients.
Why is the problem? We don't understand why.
Even before answers come in, Webster has a starting point for a solution. Patients should follow the prescription.
Do not take more than what the doctor says. You do not add another medication to that pain medication. You do not use alcohol in addition to that pain medicine.
Some analysts think doctors have swung the pendulum too far toward narcotics. Webster is concerned it might swing too far the other way, depriving patients of effective treatment.
The painkiller methadone has become one of the deadliest prescription drugs in many states. It's an issue that is growing across the country, but especially in Utah. Tonight's edition of 2020 focuses on the problem with some help from a Utah doctor. Lynn Webster says people don't specifically try to overdose on drugs, but they are looking for just about any kind of solution.
They're taking the medicine not as the physician has prescribed, but because they simply want to escape the harsh reality of pain, and that can be deadly.
Dr. Lynn Webster analyzed methadone deaths nationally and says the main problem is with new users. The drug doesn't kick in right away, tempting overdose.
Often it has to be started at a rate that's not adequate to cover the pain.
So Webster says doctors need to strongly warn patients not to chase pain with more drug.
Or if a doctor prescribes too much medicine, you may not wake up 2 to 3 days after you start your prescription.
Not wake up, as in die.
Yes.
Dr. Webster says that we should never take a prescription painkiller unless it is prescribed to you, of course. Don't take pain medication with alcohol. Don't take more doses than are prescribed. The use of other medications can be dangerous, and don't take narcotics to help you sleep. Lock up prescription painkillers. You know, Dr. Webster, these are all tips that to me seem like such common sense that our grandmothers probably told us, but many people violate these rules.
Yes, unfortunately. You know, so many people have such amount of pain that they try to escape the pain by taking an extra medication or an extra pill. So often, I think in our culture, we've thought that if you take one pill, you can take 2 and you'll get better pain relief than if you just take 1. And so often the pain's not relieved when you even take 2. And so many patients will chase their pain with additional medications, and that can be lethal. Alcohol can enhance the toxicity of all of the medications, but I think it is important to note that there are 2 of these medications, that is methadone and Zoloft, which both can lead to an arrhythmia when they're used separately, but when they're added together, particularly if he has a history of cardiac disease, which was just suggested here, the combination of these different things could lead to a lethal arrhythmia.
Jennifer's death was one of more than 100 last year in Utah blamed on methadone.
Yeah, that's really sad. It's a tragedy.
Dr. Lynn Webster says an overdose can stop breathing.
People don't understand the power behind these medications. They need to be taken exactly
as they've been told to take.
Methadone was supposed to help Jennifer Bennett Goodall. Instead, it ended her second try at life just as it was beginning.
You add all of this together, for somebody who is otherwise healthy, it can be lethal.
The advice really hasn't changed. Patients combining prescription drugs to treat different ailments should always talk to their doctor or a pharmacist about possible interactions.
People think often that it's just like taking another ibuprofen or aspirin.
Zero Unintentional Deaths is designed to educate physicians, patients, and families about potential risk when you try to mix and match.
Unless you know that, or know whether or not that drug can have an additive or synergistic, which means 1 + 1 can equal 5, that's what I mean by synergistic effect, then you're really self-medicating yourself and assuming a great deal of risk.
It's unfortunate, Dr. Webster says, that it takes the death of a prominent actor like Ledger to focus the spotlight on something that affects all of us.
Dr. John LaPook continues our special series, Easing the Pain.
Up to 25% of chronic pain patients abuse medication at some point. So companies are developing new formulations that can't be crushed, chewed, snorted, or injected.
It has the content which has a viscous gel.
One new drug being tested is Remoxy, a form of oxycodone. It's too soft to be crushed. Another drug, Embeda, is a pill version of morphine. If crushed, it releases a chemical that blocks the effect of the narcotic.
I suspect over a period of time, if these new formulations are as effective and safe as we think, that they'll probably replace most all of the other medications out there.
These pills won't stop patients from taking too many of them, but they should help doctors be more aggressive with pain and less worried about abuse.
At last count, 300 people in Utah died from prescription drug overdoses. One local doctor says 2 new pills could cut down on those type of deaths.
So this is Remoxy, and it is a capsule. Oxycodone is embedded in this. You're not going to be able to draw that up in a syringe.
Remoxy is one of the new pain pills being tested in Utah. Dr. Lynn Webster says it's tamper-proof.
You're not going to get that big hit.
Dr. Webster hopes Remoxy will one day replace OxyContin. Dr. Webster says the pills he's testing could help.
It's just too gooey. You can't do anything with it.
The painkiller in Remoxy is in the gooey substance.
You cannot inject it. You cannot crush it. You cannot get it out.
In this pill called Embeda, the effects of morphine are reversed if it's crushed. Dr. Webster admits the pills aren't the answer to all addiction problems.
It's not going to prevent doctors from practicing bad medicine. And it won't prevent everybody from overdosing. I think these medications, these new formulations, may help solve some of the problems and prevent some of the deaths. A lot of the deaths have been attributed to using these conversion tables and starting patients on too high of a dose.
Prescriptions are accidentally killing patients by the thousands each year. A Utah expert says because doctors are calculating the dose with standard reference tables that are wrong.
In fact, I call them the death table.
It's common for patients to switch from one painkiller to another.
For a lot of reasons. Nausea, vomiting, they develop a tolerance to it. It just loses its effectiveness.
Or, Dr. Lynn Webster says, the switch is necessary because the insurance company won't pay for the more expensive drug. But that simple switch can be deadly, according to the study Webster just published with Dr. Perry Fine of the University of Utah. The annual death toll from drug switching errors is hard to quantify.
I think it could be thousands nationally for sure.
When changing a patient from one painkiller to another, the doctor typically figures out the proper dose by consulting published conversion tables that give equivalent dosages.
We've been taught that these equal analgesic tables are reasonably safe as a guide, and they're not.
He says the conversion tables are notoriously inaccurate. Many doctors already cut the supposed equivalent dosage by half or 3/4.
And even then, it can be lethal with some individuals.
It's not just drug addicts or chronic long-term pain patients who are at risk.
It could be somebody who's been on a pain medicine after a hip operation or after a knee operation for several weeks, and it's not working anymore.
The conversion tables were never scientifically based, Webster says, even though the FDA and drug companies have urged doctors to use them. Webster recommends abandoning the tables. Prescribing doctors should just gradually phase out one drug and phase in the other.
And that's why we're basically on a campaign nationally to make sure that every physician who prescribes an opioid understands they can't use these conversion tables.